everybody, and thank you for joining us this afternoon. I'm Mike Rush. We know you have a ton of questions regarding COVID-19. That's why, for the next hour, we are conducting an hour-long Q&A session with Austin's Mayor, Steve Adler. Me, along with many of my colleagues, will cover several topics for COVID-19, including social distancing, healthcare, economics, schools, and the future of Austin. Mayor Steve Adler joins us now from his home as he continues to social distance himself. Thank you for joining us, Mayor.
It's good to be with you. Thank you for doing this.
So, thank you. Let's start with the numbers. Austin, Travis County, right now, 244 confirmed cases, at least in our area. That is up from 38 the day before. I remember last week you and many other professionals citing a UT Austin study said that we needed to achieve 90% social distancing in order to beat this virus, keep it from spreading, save lives. At the time, we were at 50%. So my questions to you, do you have any indication that that number has gone up? If not, why are more people not social distancing, and what can you, the city, do to make that happen?
Well, social distancing is really the most important thing that we can do. This virus just transfers so much more quickly than the flu does. You know, in the same time that one person infects one person with the flu, after 10 times, maybe 15, 17 people will have it. This virus passes more quickly. So after 10 turns with this virus, you have thousands of people that can be affected. And the other reason why social distancing is real important is that with the regular flu, you start feeling badly, and then you know to stay at home because you're going to stay at home because you're not feeling well, and you infect fewer people because of that. This virus you can have for 3, 4, 5 days before you feel any symptoms, if you ever feel symptoms at all. But you can still be very infectious and still pass this virus on. But what we do know is that if we can stay 6 feet apart, that it's real difficult for this virus to pass. It passes in droplets as opposed to the really fine spray. So 6 feet. If somebody sneezes about the distance that the drops take to fall down, it's what we need to do. Our city had been with what we were doing dropped, we think, and we just have an anecdotal basis to believe that about 50% of the social interactions we think we were able to drop. But at 50%, with the modeling that we saw, that showed us that when we got into this summer, we were still 15 to 20,000 hospital beds underwater. We just didn't have the capacity to be able to handle the spike that this virus could bring. So we have to drop those social interactions. If we don't drop the social interactions, the modeler was saying we could have 4,000 to 6,000 people that died in our city by mid-August. So it became real important for us to focus on decreasing the amount of physical interactions. Now, this virus is probably going to eventually get to most of us, and that's what viruses do. But if we can manage to spread it out so it doesn't hit all at once, then most everybody that gets it's going to be is going to be fine. We're going to be able to treat it. We have the hospital capacity if people need it. But if we get a really big spike, that's what we're seeing happening in New York City right now. It gets real scary. So we adopted, county judge and I adopted some orders to get people to stay at home more, to not be going out unless there was an essential or critical reason for you to go out, like going to the grocery store, or if you had a business that it was essential for you to be out, like stocking the shelves at the grocery store. But for everybody that could, we wanted them to not be going out, because that is the most effective tool we have, that and making sure you wash your hands for 20 seconds. You try best not to touch your face. Obviously not shaking hands, but the social distancing is
so,
key.
Mayor, I apologize. I don't mean. I don't mean to cut you off, Mayor, but we do have a limited amount of time on this particular topic, and I did want to get to the next question, which is the city, maybe in conjunction with the county, considering any more restrictive measures like shutting down the parks and trails, curfews, or police enforcement? Can you talk a little bit about that?
I think that we have to take a look at all the possibilities in order to help drive the drop in physical interactions as best we can. So yes, we're taking a look at additional steps we can take. Ultimately, we're not going to be able to enforce our way to where we need to be. It's really got to be as a community, everybody doing their part in deciding that they're going to make it happen. But yes, under consideration and our other things. We want people to go out and walk and jog, but we have people bunching up in the parks on the running trails too much, people gathering at the spillway at Barton Springs, playing basketball. These kinds of things really should stop.
And we did see that, and that was disheartening, especially since it came on the heels of you reinforcing that we needed to social distance. You've talked, and you said this last week, that everything is on the table pretty much about further restrictions, but give us a timetable. At what point do you, as the leader of the city and the other leaders of the county, decide, okay, now we have to do a curfew, or now we do need to shut down the parks and the trails?
Well, you know, we're meeting daily, multiple times, in different groups with the Emergency Operations Command, the EOC, physicians and healthcare groups on a call. Everyone's discussing this and reevaluating literally on a daily basis. The orders that we have in place now expire on April 13th. We've seen the governor's order and the president's order. They go through the end of the month in April. Obviously, we'll be extending our order. But we could do things before we got to the 13th if it looked like we needed to. We're going to get some new modeling out, hopefully the end of this week, that will reflect the more recent numbers that we have. We can take a look at those. But we also have to take a look at how's our community doing. We have a hot spot in our community right now in the West Campus area. We had some folks that went on spring break, and they've come back. And they represent, at this point, on the numbers that you gave, 20 of the total number of 244 that we have in the city. Preliminary numbers indicate that that's growing. So they've come back, and they've more of them had contracted the virus. So we're going to see in the numbers that come out this evening, again, a pretty significant increase. So if we can contain that, if the people that came back positive will help the community by limiting interactions, and as we focus on the hot spots and we focus on what's happening through the community, we'll know what further steps we need to take.
This may be a tough question to answer, but I'll ask it anyhow. Do you expect there to be, at what point do you expect there to be a peak in cases in Austin?
Well, you know, we don't know the answer to that, and part of it is dependent on how quickly it comes and whether it comes in a spike. But right now, we're thinking that the peak in our city could be in late April or during the month of May. But if we're successful in smoothing this out, we might actually reach a peak later than that, but it'll be a much lower peak that we're dealing with, something within our ability to be able to handle it with our existing health infrastructure. But I will tell you, we are at the very beginning of this, and our numbers will get much higher.
A lot of unanswered questions and variables at this stage in the game, because this is new to all of us. Mayor, if I could get you to please stand by, I'm going to now turn it over to my colleague and my co-anchor, Terri Gruca. And Terri, you're focusing on, of course, this is a health crisis, and so many people are concerned about the amount of beds that we have available, the amount of medical equipment available, and what we are doing to protect those on the front lines, the medical community that is helping those who are sick.
Yeah, Mike, in fact, a lot of the health authorities in Austin are really paying close attention to a lot of those topics. So Mayor Adler, I want to talk to you a little bit about some of these topics too. In particular, what things are like inside the hospitals. We know we have so many doctors and nurses that are caring for these patients that may have been infected with this virus. Have you heard what it is like inside those hospitals from those workers?
It's been described to me. Of course, I'm staying away from the hospitals, as we all should be, unless there's an absolute reason for us to be going to them. We haven't reached the capacity in the hospitals right now. It's good that we're no longer doing any the discretionary medical procedures, so that we are poised for a bigger crunch of people coming in with the virus. So we have excess capacity at this point in the hospitals. We're trying to marshal supplies so that we're ready. And I think that's really where we are right now with respect to the hospitals. The hospitals are taking a look right now on what they need to do in order to be able to increase the capacity to better handle surges. I think we're going to be seeing that happen. Probably we'll see some tents that are built outside of hospitals so that there can be a triage area for people, so they don't have to go into the emergency room in order to be assessed or to have tests given. But right now, our hospitals are talking to one another, our physicians are talking to one another, and we are planning for whatever it is that could come at us.
I know a lot of us are thinking about those doctors and nurses and the staff that work in those facilities. We've heard about the equipment shortages in other parts of the country. How are we as far as the supply of ventilators, protective equipment for our healthcare workers here?
Again, it depends on what kind of spike we have. If we're unable to successfully practice the social distancing, if we're not able to drive down our numbers, if people are going out and playing basketball and getting too close to each other when they head out, then we're going to have a real tough time with supply, as other cities are having around the country. You know, if this thing gets out of hand, there's no real sense of supply that is going to be able to meet that. That said, if we do the social distancing, if we can get down to decrease those physical interactions to the 75, hopefully the 90% level, then we easily have enough capacity to be able to handle what comes for us. So we are now planning for the contingency of a surge. We're sourcing those materials as the best we can from as many different places as we can, making arrangements to have it when the surge hits us. But for right now, we're in a good place for where we are and for the kind of surges that we might see. But we continue to work hard for the surges that we could see.
I know that Austin and Travis County and Williamson County set up separate places for nursing home patients who may have been infected by COVID-19. We know there were 2 patients that were infected recently. Have we heard if there's been an increase in those numbers? Is there any update on that situation?
No, I haven't heard an increase of positive tests growing out of that nursing home finding of a confirmed patient. We were able to take those patients and put them into isolated locations to try to prevent the spread of the virus. We continue to really closely monitor both them and where they came from, not only the patients in those facilities, but the people that work in those facilities.
Speaking of the people that work in those facilities, I know a lot of us would want to maybe possibly help them. Is there anything that you can think that we could do to help these doctors and nurses who I know are super stressed, not only for their own health, but their own families as well?
I will tell you that the most important thing that we can be doing for the doctors and nurses, for our EMTs, for our police and fire, the most important thing we could do would be to stay at home. To not go out, to take the number of physical interactions that we have over the course of the day as low as we possibly can. Because what those folks need more than anything else is to not be overwhelmed. If we can protect them by not overwhelming them, then they're going to be able to have the equipment to keep them safe, as well as the opportunity to actually do what they do best to save people. We have organizations in town that are accepting contributions to be able to provide things for the community, for the people that need them. As a city, we have stood up some isolation facilities so that if anybody tests positive, we can take them offline. We want to have a place for our first responders to go to in case they don't want to go home and put their families at risk, and we're standing up those kind of facilities as well. But I will tell you, the most important thing that every one of us should be doing is don't go work if your work is not essential. Do it from home. And if you can't do it from home, then if it's not essential, then let it wait. Don't be having social gatherings of virtually any kind taking place in our city that are not virtual right now. That's the most important thing we can be doing for those frontline first responders and healthcare professionals.
So you said the city is setting up sites for those doctors and nurses and first responders to go to if they need a place to stay instead of going home?
Yes, we're looking at isolation facilities. We have one now that's almost 300 room hotel that we can put people into that have the virus. But we're also looking to stand up facilities, isolation facilities, or facilities for people that don't have the virus in order to best be able to protect them, or people that suspect they might and they need a place to be able to sequester so that they don't have to do it at home.
We had some viewer questions sent in to us. One viewer said it would be helpful to know where in Austin people who have tested positive live, or maybe where they have been. I know you mentioned this pocket in West Campus. Is there a breakdown of where the cases that we have seen in our area do in fact reside or have been, so that we can maybe avoid some of those areas?
We don't have a published list of where the incidents are, but the public health department is going to those places where we get positives and then doing what's called tracing in order to be able to see who that person. Once they test positive, we want to take them kind of out of circulation until they're better. But we've been tracing that in order to be able to see who they have run into, so that we can work our way back and make sure that identify other people. But there are not places in the city per se that you shouldn't go to right now, other than the general admonition that you should be inside.
Mayor Adler, I've heard from a few people in other parts of the country who have been kept out of hospital rooms when their loved ones have COVID-19, when they've been diagnosed with this. It can be a very stressful time for those families. What kind of advice do you possibly have for the workers who have to take care of those people, or for even the family members who are dealing with that separation?
Well, I think we're all dealing with that separation to some degree. The ones that are dealing with it most critically are the ones who have loved ones that are in hospitals and in critical care situations. It's hard to even imagine. I mean, that is just gut-wrenching to even think about. At the same time, it's just really necessary. We need to separate as best we can people that have the virus from people that don't have the virus, because it's the passing of this. It's the passing of the infection and the rate that passes that presents the greatest amount of risk. So for those people that are engaging in that kind of separation, I want you to know that we all know that is absolutely gut-wrenching. For people who are at home and can't see their families, we have grandparents that are not being able to hug and hold their grandchildren right now. That's got to be, I know, an incredibly hard thing to go through, but it's necessary. As a community right now, we're having to make choices between two alternatives, neither one of which we like, but we have to pick the best of the bad choices that are presented to us.
We appreciate it. Mayor Adler, if you are just now joining us, we are doing a Q&A with Mayor Steve Adler, who has been kind enough to give us an hour of his time. We know how busy you are, Mayor, so we appreciate you being here. KVUE anchor Bryan Mays joins me now. And Bryan, I know so many of us are worried about what this virus is doing to our economy, and you're going to touch on some of those topics.
That's right. A lot of questions, no doubt, when it comes to the economy and finances for a lot of people. A lot of businesses having trouble right now. Many workers, of course, record numbers of workers filing for unemployment. So, Mayor Adler, I'd like to switch gears and talk a little about that, if you don't mind. What is your message for those businesses that are closing their doors now and those workers that are now unemployed?
I think the overarching message is twofold. The first is that we recognize the incredible financial hardship that's associated with this, and you know, it began when we shut down South by Southwest. There were a lot of businesses that were looking to make their year's income during that 2-week period of time. A lot of people lost their jobs. A lot of businesses lost huge opportunities then. But now we've gone so far past that with the sequestering that we have, the sheltering at home, and only going out to do really essential work. We know the impact of that. We have so many people now that are unemployed. We have so many businesses that have closed their doors. Many of those businesses, I know, may find it difficult or impossible to open up those doors again. So the financial issue is real. The second part of the message, though, is that for the good of the community right now, it's necessary. We can save thousands and thousands of lives if people will stay home and only go out if it's essential and critical that they go out. When people go out, you know, we all try to social distance, say 6 feet away from everybody, and that's important to do. There are some places that's hard to do. But you have to, so it's best if you can't avoid those situations that you find alternate things to do or places to be. We are trying to bring aid to those people just as quickly and rapidly as we possibly can. The city's acting, the county's acting, the state and the federal government are acting because we know that this hardship is widespread and real.
Mayor, we've been getting a lot of questions at KVUE about construction. Of course, Austin, a very thriving city before all of this happened. A lot of construction still happening across the area. What's essential, what's not? Can you clarify that for us when it comes to construction in town?
Well, you know, construction employs about 80,000 people in our community. So what the county judge and I did when we issued our orders is we said basically, if your job isn't essential or critical, then don't be going to it, because it just increases the risk both for you and your family. It increases the risk for people you don't know, the community generally. So if it's not essential or critical, stay at home. As part of that, we treated construction the same way. We said unless the construction activity is essential and critical, unless it's building something that's essential and critical, then let's not do that kind of construction. And a lot of construction stopped in the city because people recognized that it wasn't essential and critical to do. For those people that still were working on construction sites, the county judge and I have amped up the kinds of on-site rules and regulations and monitoring employees to help ensure that those workers have the safest environment they can possibly have. You know, it's a cruel choice that those workers have to make. Many of those workers don't have the same kind of social safety net that other people in the community have. When they stop working, they might not be able to access unemployment compensation. So they're forced to this horrible choice of do they put themselves and their families, their grandparents at risk or they go do that job. We're working our way through that, and then the governor came out with his order, and the governor's order trumps both the county and my order. It's real clear that his order allows residential construction to continue. We're still taking a look at commercial construction. It might very well allow that construction to continue too. That's a big link to our system. I saw that San Francisco today just adopted the kinds of limitations on construction that we had in Austin and in Travis County. They just adopted them in the city and counties of San Francisco. But the attorneys are looking at that now. We'll obviously comply and not enforce our order in areas where we have been trumped by the governor's order. I'm happy that he adopted a statewide policy. That's going to make us all safer. But with respect to construction, I think now we'll focus on just trying to make sure that those workers are as safe as they can be, and there's as little transmission as possible to the companies that are doing construction. Even if you have the ability to proceed, if the work you're doing is not critical or essential, it would be best if that construction didn't happen in our city, because it will help make us all safer.
Mayor Adler, many restaurants, the ones that are still able to operate, serving to-go or curbside delivery. We got a question from Sandra, and she asked, do you think there should be a citywide standard or rules for curbside food service? It's really not something we've seen around here.
You know, having a standard rule for that might very well be something that's worth taking a look at, so that we can make sure that the best practices are being shared. We haven't done that yet. People are focused right now on the immediate crisis that we're trying to deal with. And it hasn't been pointed out to me that presents an immediate health need in the city, but sure, something that makes sense.
There are a lot of people, no doubt, working from home, telecommuting. I know you were in favor of this long before this whole thing began. Do you think that's something businesses are learning a lot about and maybe will be and should be utilizing after this baptism by fire that we faced the last couple of weeks?
You know, I think there are probably a lot of things that people are trying now that are going to work our way back into our lives on the backside of this, and there will be a backside of this. I've been on a lot of Zoom calls and team calls where we used to get together in a conference room. Now we're having these meetings virtually with a split screen that has a dozen people on it. I kind of like those meetings. It's a really efficient way. We can, let people look at documents and share documents in those meetings. It wouldn't surprise me at all if some of the things that we're all becoming tech savvy at now by necessity, I bet some of those things last in common usage into the future.
All right, Mayor Adler, my last question, and again, thank you for your time today. It's a pleasure hearing from you. We, of course, don't know when this is all going to end. Will the city have a plan to move on from our current stay-home, work-safe order to our normal routine? Will it be segmented? Will there be a day when the order is lifted and everybody just goes back to work? What's the city's plan, and is there one?
You know, the planning is ongoing right now for what the recovery from this is, what the resiliency is from this. That work started the same time that the emergency work for the virus response started. So yes, there are teams that are working on that right now to help us rebuild our economy and start up our economy. Jimmy Flanagan authored a bill that the City Council considered last meeting, and all the council members, all my colleagues pitched in to help look at the things that we could initiate from an economic development standpoint. There are going to be other resolutions associated with that at our next city council meeting. I can already see Mayor Pro Tem Garza and others filing things on our message board, giving us all indications that we're moving toward that way. So absolutely, yes, there's a lot of attention being spent right now on rebuilding the economy. We don't know exactly what the transition is going to look like. We don't know if one day we say, okay, the orders are over. Probably more likely, in my mind, probably there's a lessening of what the restrictions are over time so that we can do it in a measured way in order to ensure that we don't have an unanticipated peak somewhere down the road as well.
Mayor, thank you very much. Turning now to education, and my co-anchor Yvonne Nava joins us now. And Yvonne, yesterday, Governor Greg Abbott told us children will not be allowed to go back to school, public school, until May the 4th at the earliest.
Oh, and Bryan, that date could be extended. And that leaves a lot of parents like myself thinking, okay, so what are we going to do for the next month as far as homeschooling our kids? Mayor Adler, Yvonne Nava here, and we're going to be speaking about education. Thanks for joining me right now.
Absolutely. Thank you.
So many questions to get to. Thank you for your time. You know, these last few weeks have put all students behind, disadvantaged students even more so. You know, not every school, or rather not every home, I should say, has a computer, has high-speed technology, has high-speed internet. Can you tell us some of the steps now being taken by area schools to switch to this remote learning, which is new to all of us?
It certainly is. You know, there are a lot of things that we're doing now that we wouldn't have anticipated a month ago that we would be doing now, and we're in positions that we did not anticipate that a month ago that we would be in now. And certainly schools are among those. So the school decisions in each one of the independent school districts are made by the superintendents and the trustees of those independent school districts. So the best place to get the best answer to that question will be to speak directly to them. But in our emergency operation command meeting that meets every day, the superintendents are represented on that call, and then I know that they have a separate call that all of them are together in like 20 different districts in the surrounding area. So I know that they are all looking right now at trying to maximize the educational opportunity for the kids in the schools. They've all seen now the order that came from the governor, and I would imagine that they're all trying to figure out now what is it that they do. But I haven't heard a final decision made on that. It goes past the governor's order yet. I just know that they're working really, really hard to try to take care of kids as best they can, not only their educational needs, but also making sure that the food and that is served to students, many of whom get some of their best meals at school, continue not only for them but for their families as well in some instances. I know the schools are working really hard.
Mayor, it's hard enough for parents already working from home. How are we supporting those students, or how can we support those students who don't have caretakers at home to walk them through the curriculum? Because it's a process to homeschool.
It is a process to homeschool, and it's hard. You know, for the families that have some measure of technology. You know, it's good that there are a lot more online services and opportunities and resources today than ever before. Obviously, there's a concern for the communities that don't have the same kind of access, and that's something that I think each of the school districts are focused on. I don't know what they're doing in that regard.
Mayor, is any thought, I'm sorry about that, is any thought being given right now to perhaps cancel this school year? Is that an option?
Well, it's certainly an option. Each one of the school districts makes that as an independent decision. That's not something that we decide as a city, because those are independent school districts. But I know that they're considering right now all of the options that they have, trying to figure out just how meaningful and helpful school would be if they were to try to reconvene, and if they tried to reconvene, in what form that might be. The answer to that question, again, best directed to the independent school districts.
Mayor, Austin is a tech-savvy city. It's a tech city. So have any Austin companies perhaps maybe reached out to you to maybe help make donations in the form of maybe Chromebooks or laptops, or any kind of, donation or any kind of help from some of these companies here in town?
From the city side, dealing with the response to the health crisis, many of the tech companies have reached out to offer technological support. Some of them have offered to reach out with manufacturing support or connections to manufacturers, both here and overseas, to maybe source some of the masks or personal protective equipment that our healthcare providers and first responders need. So there's been a lot of involvement in that. We have some of our tech folks that are looking at innovative solutions to ventilators and trying to build out field ventilators that might be something that we can use. We have different tech companies that are working on different testing procedures. So from the health side, which is what the city's involved in, we have a lot of people that are trying to help in tech companies. Your question was more in support of schools and donating laptops and those kinds of things. And I don't know what kind of communications that our independent school districts are having with those same companies.
Now, Mayor, I know that this year STAR testing was canceled for the remainder of the 2019-2020 school year. So how will not taking these STAR tests and missing so much school perhaps impact the readiness for Austin to meet the state standards and perhaps for the next school year? What do you think?
I don't know the answer to that. Again, best directed to the schools. But I add that among the challenges that I know that we're going to have to face. When a virus like this comes to a community, we're all constantly being given a forced choice between options, and we don't really like any of them. So not being able to do the testing, not being able to have the kids in the classroom, are all things that are not good. And there's going to be ultimately a price that we pay for all of those things. It's just that the price that we pay if we don't do those things is even greater. Because if we don't do the things that are having to be done now, then we lose lives. And the first priority, going all the way back to South by Southwest, has been to focus on how do we keep people safe.
And Mayor, have our schools and the city perhaps together ever planned for a crisis like this?
We plan at the city level and at the county level jointly for crises like this. We run drills, we run tests. In fact, there were 75 of us that at the invitation of FEMA were going through a almost like war games exercise in Emmitsburg, Maryland, as a team. Just as this was hitting at the very early part of March, so it was real ironic that we were in that war game setup, having our first and preliminary meetings of the emergency operations group on the virus. So we've planned for lots of different kinds of contingencies, a lot of different kinds of mass casualty events, things that could come to our community. The systems are in place, and now we are following through on the emergency operation procedures that the city and the county have.
You know, homeschooling is no joke. It's a juggle for a lot of families. And what advice do you have for parents trying to homeschool for the first time?
Well, I'd say find enjoyment in the opportunity to be able to be spending time with your children that you might not otherwise have. I know it's not the circumstances that you'd want, and I know that it's hard to do sometimes. But we have to find those moments and of joy and real opportunity that we're now getting because of the hardship associated with dealing with the virus. We all have things that we can teach our children. Just being with our children is a wonderful thing. Last night I was looking at Nora, second grader, sent me a picture of a garden that she had done with her father that I'm sure she was really proud of, and she sent it to me together with a drawing she made of her father, a lucky dad. And I think that right now in this city, there are lots of those kinds of moments that are happening because really that's a big part of what our lives are right now.
You're absolutely right. We have to look for the silver lining in that time that we're getting with our kids. So that's for sure. Mayor, thank you so much for joining me. And if you're just now tuning in, we're talking live with the Austin Mayor, Steve Adler. We have so many questions about the coronavirus, and he's been kind enough to spend an hour to answer these questions. And now turning over to my colleague, KVUE anchor Quita Culpepper. She joins us now. And Quita, we know a lot of people are hurting right now, especially underserved populations in our economy and in our community.
They really are, Yvonne. And, we wanted to take a little time to talk with Mayor Adler about how older adults, people who are homeless, and those who are underserved in our community are coping with the COVID-19 pandemic right now. Plus, we also know that it's a very important time for all of us to think about our mental health and to focus on that a little bit. And Mayor Adler, I wanted to start with a topic that's divided so many here in Austin and in Travis County, the homeless. We really want to know what's being done at local shelters to keep the number of COVID-19 cases down in that population.
You're right. The folks that are experiencing homelessness in our community are among the most susceptible to something like this virus. So the shelters that exist are screening and testing people that come into those shelters, and when someone's identified with symptoms, or someone's identified that we get that person testing. And if someone tests positive for the virus, we pull them out of that community, put them into an isolation facility somewhere where they can not spread the virus. We're also taking the people that they may have been with in a kind of a group where they might have been. And also isolate that in case there's been a transfer of the virus, so that it's sort of a version of self-quarantining because they don't have a home. Obviously, they can't go home to do that. We have a 300-room hotel that we are now bringing online, putting people into already that can help serve as an isolation facility in our community. We're following up with additional hotels in order to be able to increase our capacity to be able to do that. We also have the teams.
Well, I know that.
I'm sorry. And we have our regular services, the host teams that are still addressing that community.
Well, Mayor Adler, I know that it's easy to get in touch with and to keep an eye on the homeless who are living in shelters, but what about those who don't stay in shelters, who are living in homeless camps right now? Is the city, I guess, reaching out to them, talking to them, keeping an eye on them?
Absolutely. we want to be able to affirmatively be able to find and identify people in that community that have the virus, so that we can pull them out of those communities, get them into an isolated place, and take people that they may have been around in those communities and be able to isolate them as well. So that goes not only for the shelters, but also for the encampment areas that we have.
Now, we have a question from one of our viewers, Robin Rosenstock. She says that she's a senior with risk factors. She lives alone, as do many others that she knows. And if she gets even mild to moderate symptoms or even gets full-blown COVID-19, she won't be able to take care of herself. She says, Mayor, you have made arrangements for the homeless. What about your older constituents?
We have facility right now for anyone in our city that tests positive and doesn't have the ability to be able to quarantine or take care of themselves that way. If someone feels like they have developed the symptoms, the first thing they should do is call their physician and call community care if you don't have a personal physician, so that you can be told what is the right thing for you to be doing. They'll ask you a series of questions, and they'll make a determination as to whether or not you should be just staying at home and alone and isolating yourself from others, or whether your condition is such that you should go to a hospital. But begins with a call to the primary care physician. And then there's an opportunity then, as the doctor might indicate, for someone to be able to receive a test. I would also say, Robin, I appreciate the call. And if people know Robin or people like Robin, you should be calling them or better than texting them. Call them up and ask them how they're doing.
Right. Well, I know that those facilities that you were just talking about, will that also count for people in nursing homes? I know a few residents in a North Austin nursing home were just diagnosed or just tested positive for COVID-19 this week. Let's talk about what the city is doing to try and keep COVID-19 from running rampant through those kinds of facilities.
So the city is standing up a nursing home facility that was in a position to be able to take COVID patients, and have them isolated from patients, from like the patients in the nursing home that they had come from. And that's what we're doing right now. We take those patients, we remove them from that place, we get them into another place that has the ability to provide the appropriate care and attention that they need. And then they're going back into that initial nursing home. They're giving people in that home tests to see if it happened to spread, both workers there as well as patients there. And then they go in to help clean and disinfect those places, so as to really try very hard to minimize the chances of the virus spread.
Mayor Adler, we've gotten questions from people in the community about what's being done in our jails and other holding facilities. They say that inmates and employees are basically sitting ducks for this virus because they're in such close quarters. What's being done to keep them safe and to keep the virus from spreading from inmate to inmate, or from inmate to officer, inmate to guard?
Well, as you might imagine, that also is as the question asks, also an area of significant concern. So we know that the sheriff is on top of this and executing her plan in the jails. They're testing people that are symptomatic. They're removing those people if they're determined away from the rest of the population. If that happens, they're testing everyone before they're released. And if someone were released, had a positive test, then that person's going to be isolated. People that are coming into the prisons are isolated for 14 days before they get into the general population. population, so as to make sure that they come into the population without the virus. We're doing everything we can as a community to both protect the general community, but some of these areas that we all recognize have greater risk.
Mayor Adler, we both know people are lonely, they're scared. Social distancing, it's a pretty difficult thing to have to go through. But has the city thought about putting something together online, perhaps, that could help with things like finding someone to deliver food or medicine to someone who is elderly, or volunteering to distribute food through local food banks or donate to fundraisers?
You know, you're absolutely right. Kind of the mental health or emotional component of this is really real, which is probably why we should never have called this social distancing. We should have always been calling it physical distancing, because we want people to maintain that physical distance, but we want people to be engaging and maybe redoubling their efforts to engage socially. We want to have interaction. That's why you want people to be talking on the phone. If you know somebody who is isolating themselves or might be lonely, don't text them. Pick up the phone and call them and actually talk to them. The services that you're indicating, I think, are a really good idea. I think that some of those already exist in the city, where people can call and get help with shopping if that's not something that they're otherwise able to do, to get food delivered. But this is now really important, that it's a time that we really do extend ourselves to visit with and talk to people, to get on, to learn how to use Zoom and have an evening party with a group of friends, all virtually and on a computer. It's a great opportunity to learn how that works for those of us that can do that, because the social aspect of this is really hard.
All right, Mayor Adler, thank you so much. And you know what? I'm going to toss this back to my co-anchor, Mike Rush. And Mike, I know a lot of us are wondering what the future looks like as we're living in such uncertain times. And we just want to send some positive messages of hope.
Well, that's for sure, Quita. These are very heavy times that we're in right now, a heavy topic, no doubt, but we do want to look ahead to our bright future and the light at the end of the tunnel. Mayor Adler, you know, I think from families' point of view, one positive or a few positives they may be able to take out of this is that they're able to spend more time with their kids, or people are able to read more books that they've been meaning to get to, or take up a hobby. But from a city's point of view, from the city of Austin, what do you think that coming out of this pandemic we will have learned or achieved that will actually make us a stronger, better community, even more so than if we had never had this crisis?
Well, I hope we learn a lot, and I hope when we come out of this, and I expect when we come out of this, and we will come out of this, that we're stronger than we've ever been. I think that it's going to have a lot of us more tech savvy in ways that we were not before. I think we're spending a lot more attention right now, really focused on the most vulnerable in our community, because those vulnerabilities are just so amplified and magnified in what we're seeing right now. I hope that we have strengthened our social service support for communities that otherwise are not getting what they need. I hope that it really has us valuing the folks that are in our service industries in ways that we may not have before. I hope that it means that we can get to a place where we have sick leave for everybody in our community, so that no one who's feeling sick has to choose between going into work or not getting a paycheck. So I hope we have advances on that front. And obviously, every time we go through an emergency like this, our emergency response capabilities are going to be better than they were before. And my hope is that kind of communally as a city, we've had more time to focus on what it is that's really important. I mean, that the community is order to save 4,000 to 6,000 people, I think is important and helps us grow as a community.
When you get down to the basics, you do really start to realize what is important in life, that's for sure. Mayor, let me give you a question from Susie. She's from Austin, and the first thing is she says she is staying at home, and I know that's the number one thing that you're saying that we can do to help everybody is to stay at home. She is doing that, but she wants to know what else can she do to help. A lot of people are wondering that. We're a community of very big hearts. So what can we do from home to help others?
You know, there are opportunities for the most important thing is to stay home, and I just want to say that again. That's what we should all be doing. Apart from that, I would be reaching out to people that we know are at home and by themselves, because that's an important thing for us to be doing. There are also sites that you can go to help contribute to folks that need the assistance at this point. The United Way and the Community Foundation. I would go to both them. They've stood up something that for the life of me right now, I can't even remember what it's called. It's like All In for Texas, All In for Austin, All In ATX, I think is what it is. But it's the United Way and it's the Community Foundation. Stand With Austin is another good place to go to give contributions. But the most important thing that any of us could be doing right now is help setting the cultural and social norm for people to stay at home if it's not critically or essential that they go outside.
You just can't drive that point home enough, because that is the number one thing that we can do to help. Mayor Steve Adler, we certainly do appreciate having you on for this hour this afternoon to pass along this important information. We know that your time is very valuable, especially during this time of crisis. So thank you so much for coming on this afternoon.
Thank you for the opportunity.
We'll talk again soon. Thank you, sir. And the mayor had just alluded to something that I want to remind you about. You can get the latest news. Well, before that, let me go to a different script here. We want to remind you about our digital telethon coming up on Friday. KVUE is partnering with other media groups across Central Texas for a campaign called All Together ATX. We're raising money for the Austin Community Foundation and the United Way for Greater Austin so they can help people affected by COVID-19 in our community. So far, we have raised $872,000. It's a great start, but more to go. If you're able to pitch in, just look for this story on KVUE.com. And now we also want to let you know that you can get the latest news about the coronavirus pandemic sent straight to your cell phone. We've been telling you about this. You can send a text message with the word fax to the KVUE newsroom at 512-459-9442. Calling won't work. You do have to send a text message with the word fax on it to the number on your screen. We want to thank you for watching this afternoon KVUE News Special Question and Answer with Mayor Steve Adler. We have much more information on KVUE.com, and we will also be live at 5, 6, and 10 with the very latest on this crisis. Have a great afternoon.